Next tip that I have for you guys is making sure you're asking questions. This is definitely a good time to ask questions. There is never a bad or stupid question to ask when you're in clinicals. This is exactly the perfect place to ask questions. So if your preceptor is doing something, said something, and you're not sure why they're doing something, ask them. Like, why is it that you go about doing this a certain way? Or why is it, this patient was experiencing this, or why was it that you gave them this medication? Or, you're going to look at labs together. You're going to look at diagnostics together, and anything you're not understanding, even if it's something you guys haven't covered in nursing school, it's still the perfect opportunity to ask questions and to then see how it relays with your patient. And it just gives you a better understanding of your patient and understanding what's happening with your patient, so that you're starting to kind of put all of the pieces together and knowing what's going on. And then also, you can also ask your clinical instructor questions as well. So aside from just your preceptor, you can ask other nurses questions. And sometimes other nurses will even bring you in if there's a procedure going on that they're doing, if there's a skill that they're doing that you haven't seen, even if you haven't been checked off on it, they can allow you to at least be in the room to watch. So if you have the opportunity to just go and watch something, take it. Honestly, go and do it. That's just another experience to have under your belt that you've seen something done, even if you haven't done that skill yet. So take up those opportunities. If a nurse has something going on, make that known to nurses too when you go to the clinical. Say, if anyone's doing anything that is really cool or that I haven't seen, if I'm able to do it, if you would allow me to do it with your presence, I would love to. Or if it's a skill that you can't do, but you would love to see in action, let all the nurses know in the unit. Most nurses love to have someone there that they can teach and show. So make that known too, because again, that's just going to build off of what you're going to learn and what you're going to experience. And it makes it that much easier, right? Going forward. It's like practice, right? So make it known. Make it known what you want to. Preceptor is always there for you to help you. The same with your professor or your clinical professor. They're there to help you as well. Another question I have gotten from students as well is having a preceptor or a nurse that isn't very, nice, or you can tell they don't really like having students, or they don't really teach very well, or anything like that. If you come across that, because clinicals, guys, it's supposed to be an area that you get a lot out of and that you're going to learn a lot from, right? It is a learning experience for you. If you feel like you're not getting anything from it and you feel like you're not being taught anything or shown anything, or if your nurse isn't allowing you to do certain things that you should be doing, like vitals or head to toe assessments or giving medication, or maybe further in nursing school when you can do IVs, if they're not allowing you to do these skills on clinicals, that's a big deal, because that is what these clinicals are made for. So at that time, if you're having an issue with a preceptor, there is nothing wrong with going to your clinical instructor and saying, hey, Susie's not allowing me to do this. She's not really good at explaining anything. She's not teaching me anything. I don't feel like I'm getting anything out of this. It is okay to do that. And your clinical instructor will be able to then match you with somebody else that you can learn from, that is going to teach you and it's going to help you. Because again, this is your time to get the most out of your clinicals, to learn, because hands-on experience is the best way to learn any skill, anything. Charting, you're going to go over charting, you're going to go over labs, you're going to go over diagnostics. Literally, it's going to be the best of all worlds to learn anything and everything that you need is the clinical setting, hands down. So make sure you guys are utilizing it to the nth degree. It is so important to make sure you get the most of it while you can, okay? Very, very important. Hey everyone, if you enjoyed watching that clip and you want to see the full video to it, make sure you guys click the box here. If you enjoy watching these kind of videos and you want to see more videos from the Nurse Kristen YouTube for pre-nursing, nursing student, new grad nurses, make sure you guys hit the subscribe button over here.